Peppermint is one of the most commonly used essential oils, and for good reason. So let's talk about some of the science-backed research on this powerful oil. Welcome to Boldly Essential, where we give you ways to consistently nourish your mind, body, and soul. I'm Stephanie Mello. Today I'm sharing about one species of peppermint, Mentha piperetta, which is a hybrid of spearmint and watermint native to Europe and the Middle East. It has a minty, cool, and invigorating aroma. Its dominant chemical compound is menthol, which I'm sure you're already familiar with. Now let's dive into some selected research. If you're interested in the citations for these highlights, I've linked that book below. Disclaimer, at Boldly Essential, we do not diagnose, treat, or cure any disease or condition. This is meant to empower you with the scientific knowledge and what they have found in research as some of the potential benefits. Some of this research was done in vitro, other was done with animal studies, and other in human patients. So let's get into the first one, which I'm sure we've all struggled with at some point, probably in the last week, daytime sleepiness. Inhalation of peppermint oil was found to reduce daytime sleepiness in people when they were subjected to the conditions that normally made them sleepy. Nausea. Inhalation of peppermint oil may reduce the frequency and severity of nausea and vomiting and the need for the drugs used to treat it. Another study found that taking 3 deep inhalations of ginger, spearmint, peppermint, and cardamom from a gauze pad reduced anti-nausea medication requests. The severity of pregnancy nausea was mildly reduced among women after inhaling 4 drops of peppermint in a bowl of water placed next to their bed while they slept. Oral administration of peppermint and spearmint in a sugar capsule, along with other medications, significantly reduced the number and severity of vomiting episodes in chemotherapy patients. Breathing. Inhalation of menthol, the main constituent of peppermint oil, was found to improve bronchodilation in animal research. Peppermint oil also enhanced the absorption by 28% of a medication used to treat asthma. Exercise performance. Oral administration of peppermint oil in water for 10 days resulted in improved exercise performance, blood pressure, and respiratory performance in young males. Exhaustion. We've all been there, and in this study they found a combination of peppermint, basil, helichrysum reduced mental exhaustion and moderate burnout in a pilot study. Headaches. A combination of peppermint and ethanol applied to the forehead and the temples of healthy people with a sponge saw reduction in headaches. Mosquitoes. 2 different studies found that the peppermint essential oil killed the larvae and repelled the mosquitoes that cause dengue fever. Task performance. Inhalation of peppermint oil enhanced attention, speed, and accuracy while performing clerical tasks. If you're enjoying this video, please be sure to like it and make sure you're subscribed to this channel as well so you don't miss the rest of the great information on peppermint oil and other resources to nourish your mind, body, and soul. In patients with arthritis, topical application with a 1.5% solution of lavender, marjoram, and eucalyptus in carrier oil significantly reduced pain and depression in those patients with arthritis. Constipation in elderly people. Abdominal massage with lemon, rosemary, and peppermint relieved constipation in patients, and the effects lasted for 2 weeks. Seizure prevention in mice. Injection of peppermint oil into animals prior to receiving a drug used to study seizures protected them from seizures and increased survival rates to 100%. Reducing itching. Peppermint oil was found to reduce itching that was caused by allergies or drug or kidney or liver disease. And the reduction of symptoms of upper respiratory tract infections. Researchers evaluated the effectiveness of a spray. The spray was administered in 4 sprays 5 times a day. It contained oregano, peppermint, rosemary, Eucalyptus globulus, and Eucalyptus citrodora in people with upper respiratory tract infections. The researchers concluded that those who used the spray had significant reduction in their most debilitating URTI symptoms within 20 minutes. Another study found that peppermint, thyme, and lemongrass inhibited respiratory tract pathogens, pyogenesis, and Streptococcus pneumoniae. Improved colonoscopy time, spasms, and pain. Oral administration of peppermint oil in capsules prior to the colonoscopy decreased the required time to perform the entire procedure and reduced colon spasms and pain. In another study, they found that the topical application of peppermint reduced peristalsis before and after the procedure. And a third study found that when peppermint was mixed with the barium enema solution, residual spasms were significantly reduced during and after the examination. Gastrointestinal motility. Another study found that peppermint oil slows gastrointestinal motility, which may have a very positive effect on diarrhea. Oral health. In vitro clinical research concluded that peppermint was more effective than chlorhexidine in preventing the bacterium Streptococcus mutans and Streptococcus pyogenesis from sticking together and forming plaque, which they suspect could prevent cavities. Another study that peppermint kills pathogenic oral bacteria. Another one found that 3 minutes of oral cleansing with tea tree, peppermint, and lemon oil reduced bad breath and the production of volatile sulfur compounds in ICU patients. Improved lung function. Russian scientists found that inhaling peppermint oil for 20 minutes daily for 2 months improved the symptoms for those who had pulmonary tuberculosis and prevented reoccurrence in those people. Reduced athlete's foot. A foot bath of 107 degrees Fahrenheit with salts and essential oils significantly reduced fungi associated with athlete's foot in vitro. The following oils were tested and produced positive results: oregano, thyme, cinnamon, bark, lemongrass, clove, palmarosa, and peppermint, as well as lavender and geranium. Other pathogens that it's been studied against. It's been found that it can inhibit C. albicans, yeast, T. asacii, and T. cutaneum, and other research found that it was effective inhibitor of E. coli, Staphylococcus aureus, and Staphylococcus faecalis, and K. pneumoniae. These are pathogens that can cause urinary tract infections, wound infections, pelvic infections, bone infections, and endocarditis. And herpes. Peppermint significantly kills HSV1 and HSV2. It also prevented healthy cells from being infected with both viruses and is active against acyclovir-resistant HSV1. Cancer. In vitro research suggests that peppermint oil is significantly active against lung carcinoma, leukemia, and stomach cancer cells. That same research concluded that peppermint is a mild antioxidant and inhibits pro-inflammatory production of nitric oxide and prostaglandin E2. Another study found it significantly killed cervical cancer cells. Another found that it reduced lung tumors. So there you have it, over 19 documented ways that peppermint has been proven to be beneficial. If you want more information, make sure you check out the link below for the book. And if you're serious about taking care of your mind, body, and soul, Loyalty Rewards is the simplest way to nourish you. Learn more about the benefits of Loyalty Rewards in the link below this video. Thanks, and I'll see you next time.